The World Health Organization put out questionable guidance on how to deal with the coronavirus. It was slow to communicate the magnitude of the threat, and it whitewashed the Chinese government's early handling of the crisis. It destroyed much of its credibility, damaged the field of public health, and failed to contain the pandemic.
Now is not the time. That's a bit too early to consider that this event is a public health emergency of international concern.
WHO's response in part stems from its overly deferential stance towards China, which is its second biggest contributor among 194 member states.
A phenomenal collective action and cooperation by the people of China to this response.
We would have seen many more cases outside China by now if it were not for the government's efforts to protect their own people and the people of the world. The Chinese government is to be congratulated for the extraordinary measures it has taken to contain the outbreak.
WHO whitewashed the authoritarian government's overall record. It praised China for releasing the virus's genome while neglecting to mention that it took them at least 17 days to do so. It didn't report human-to-human transmission until late January, even though Chinese doctors suspected it at least a month earlier. Although the extreme lockdown of Wuhan likely did save thousands of lives, WHO scientists weren't allowed into Wuhan until 3 weeks after the outbreak first came to light. Meanwhile, the WHO praised the Chinese for their openness.
China took action massively at the epicenter, and that helped in preventing cases from being exported.
If we say there's a pandemic of coronavirus, we're essentially accepting that every human on the planet will be exposed to that virus. And China have clearly shown that that's not necessarily the natural outcome of this event.
As the virus continued spreading across Europe and reached America, WHO recommended that the travel industry maintain the status quo.
There is no reason for measures that unnecessarily interfere with international travel and trade.
One country that ignored this advice was Taiwan, which also warned the WHO that it suspected the virus was spreading through human-to-human transmission and was ignored. Taiwan, which has one of the lowest rates of known COVID infections per capita among countries impacted by the virus, was prevented from joining the WHO as a member country in 2015 by China, which refuses to acknowledge its independence. In late March, World Health Organization epidemiologist Bruce Aylward declined to answer a Hong Kong reporter's question about Taiwan, or even acknowledge its existence.
Would the WHO consider Taiwan's membership? Hello?
I couldn't hear your question.
Okay, yeah. Let me repeat the question.
No, that's okay. Let's move to another one then.
Right, because I'm actually curious on talking about Taiwan as well, on Taiwan's case.
We decided to give Dr. Aylward another call to follow up.
And I just want to see if you can comment a bit on how Taiwan has done so far in terms of containing the virus.
Well, we've already talked about China, and when you look across all the different areas of China, they've actually all done quite a good job. So with that, I'd like to thank you very much for inviting us to participate.
As Taiwan was distributing face masks to its citizens, the WHO was advising the rest of the world that they were unnecessary. And initially, the CDC and U.S. Surgeon General followed its lead.
Masks should only be used by healthcare workers, caretakers, or by people who are sick with symptoms of fever and cough.
If you do not have these symptoms, you do not have to wear masks, because there is no evidence that they protect people who are not sick.
But health experts pointed to mounting evidence that masks can help slow the spread of respiratory diseases, especially among asymptomatic carriers, a population that the WHO maintains is virtually non-existent, despite mounting evidence to the contrary. In mid-February, the WHO trumpeted good news from China.
The data from China continue to show a decline in new confirmed cases. Once again, we're encouraged by this trend.
Ignoring evidence that it may have been a statistical anomaly, and U.S. intelligence believes that China has entirely misrepresented both case numbers and death tolls according to Bloomberg News. Finally, on March 11th, after Italy was already in full national lockdown with more than 10,000 cases, WHO finally acknowledged the true magnitude of the crisis, declaring a global pandemic.
COVID-19 can be characterized as a pandemic.
They could have called it months earlier. They should have known, and they probably did know. So we'll be looking into that very carefully, and we're going to put a hold on money spent to the WHO.
Donald Trump and other world leaders aren't absolved for their failures by the WHO's bungling of this crisis. But it's important to remember that if the World Health Organization had done its job, the nightmare we're living through might not have happened at all.
Coronavirus is on everybody's mind right now. Let us see the structure of coronavirus. The structure of microorganisms help us to understand their various properties, like how they survive, how they infect, and also help us to deduce methods for detecting them and for creating ways to prevent and treat the infection. Well, viruses can only survive within a host cell because they have a genetic material which enables them to reproduce. However, they do not have enzymes required for protein as well as for this nucleic acid synthesis. So, they need help of some other cells so that they use their machinery and produce proteins and enzymes necessary for their protection as well as for their multiplication. So first we will discuss the structure of viruses in general, and then we will see the aspects particular to coronavirus. All viruses have a genome, which is surrounded by a protein coat known as capsid. The genome may be either DNA or RNA, but never ever it is both. This is contrast to all other organisms which have both DNA as well as RNA. The protein coat, that is the capsid, is basically proteins which are arranged in a symmetrical manner and form a protective shell for the nucleic acid. The symmetry may be either icosahedral, that is, has 20 triangular faces, or it may be helical. So all viruses have a genome and a protein coat. Now with this, some viruses may be enveloped, while some may not be enveloped and will have only this protein coat. These are known as naked viruses. In the enveloped viruses, the envelope is made up of lipoproteins, that is lipid and proteins. The lipids are derived from the host cell membrane which the viruses infect, and they acquire it while they are leaving the cell, while the proteins are synthesized by the viral genome using the host machinery. So this is the basic about structure of viruses. Now viruses have been broadly classified into 6 types based on their genome. First class includes viruses with double-stranded DNA. Second class, viruses with single-stranded DNA. Double-stranded RNA viruses in third class, and in 4th, 5th and 6th class are single-stranded RNA viruses with some differences. In 4th class, single-stranded RNA viruses are there but have positive strand RNA. That is, RNA same as that of mRNA, which can be directly translated into proteins. While in class 5th, that single-stranded RNA has opposite polarity to that of mRNA. So these RNAs need to be first converted to positive sense RNA, which can then be translated to proteins. It is not direct translation. In 6th class, single-stranded RNA viruses are there, but these viruses have the capability to synthesize DNA from their RNA since they possess an enzyme, reverse transcriptase. Well, you may ask that why do different viruses have different genome? Well, it is not much the need of the virus. The answer is more in evolution. There were different types of organisms which arose. The ones which survived remain in nature with their own ways of replication. Okay, coronaviruses belong to this group. That is, they have single-stranded positive sense RNA with a protein coat. Also, they have a lipoprotein envelope. So these are enveloped single-stranded positive sense RNA viruses. So what are the features of each of the components of this coronavirus structure? If we see the genome, we have said that it is single-stranded positive sense RNA virus, but the genome of coronavirus is very large. In fact, it is among the largest mature RNA virus molecule known. Secondly, the nucleocapsid of the coronavirus has helical symmetry. Now this is an exception since generally helical symmetry is present in negative strand RNA viruses. That is in class 5th. while positive strand RNA viruses generally have icosahedral symmetry. So that is also one unique feature of coronavirus. Now let's come to the lipoprotein envelope. The lipoprotein envelope has lipids derived from the host cell membrane, and the proteins in this envelope are synthesized from the viral genome. One of these proteins, known as spike protein, has extracellular portion, and thus it projects from the membrane and kind of forms a rim around the membrane. When looked under electron microscope, this rim formed by these spike protein appears like a corona of the sun, and that's why this virus is named as coronavirus. This spike protein is the one through which virus attaches to a receptor, and then the virus and host cell membrane fuse together, causing entry of viral genome, that is this RNA, into the cell. For more detail on this aspect of mechanism of action of coronavirus, there will be another video. Okay, there are two other proteins. One is known as membrane protein, M protein, which gives the virus envelope its shape, while the other is E protein, that is envelope protein. Both of these proteins are said to have roles in the assembly of the virus genome, capsid, and the envelope. So it brings all the components of the virus together as the virus leaves the host cell. So in this video, we discuss the basic structure of viruses in general and of coronavirus in particular. Okay, thanks for watching the video. If you liked it, do not forget to subscribe to the channel.